Hey guys, welcome back. I'm Comeback Craig, and today we're talking about VA ACE exams. It's a version of a C&P exam, and I got the question, so let's throw it up. Just got a letter, C&P appointment for headaches due to tinnitus. They said I did not have to attend. They were just going to review evidence and make a decision. Good or bad? All right, let's talk about what a VA ACE exam is, and then we'll talk about whether it may be good or bad for your VA claim. A VA ACE exam is a records-only review. They review certain disabilities that you filed a claim with. It is a C&P exam, but it's not an in-person C&P exam. The C&P examiner is going to review your records. You don't need to attend. And then the VA rater is going to get the information back, and they're going to adjudicate your claim, and you're going to get a decision. So it's the same process, works the same way, with the exception of you don't have to show up. It's not an in-person C&P exam. One thing you should know is sometimes the C&P examiner that's conducting the ACE exam will call you and ask you questions about your disabilities, just due to the nature of it. Normally, they sit there and they literally ask you questions because you're sitting there. So I would be prepared to answer those questions. Be prepared to talk through your disability, and if you have your DBQ filled out already, you'll be in good shape. If you want to learn more about the VA claims process, what you need to prepare for C&P exams, check out my boot camp at combatcraig.com. And then I mentioned disability benefits questionnaires. It is a good idea for you to have one filled out by your doctor representing your best interest, so you have positive medical evidence. So if you need medical evidence, hit up my med team. There's an email address in the description. What C&P exams can be conducted using the ACE exam process? VA ACE exams are not available for everything you file a claim for. They're limited. And here's the list: hearing loss, tinnitus, migraines, sleep apnea, cardiac conditions, ALS, and any terminal condition. So when you're kind of thinking about this, where might I do an in-person exam, telehealth exam, or an ACE exam? Hands-on stuff, right? Where they're measuring you with a goniometer, orthopedic exam. Any broken bone and ripped ligaments and stuff, that has to be done in person, right? Hands-on. An ACE exam, they could do these types of claims because there's nothing they're going to glean from the C&P examiner. The C&P examiner can't, say, all right, come back, Craig, you're in here for migraines. Migraine out, dude. Migraines don't work like that. If you have them, Let's see some hearing loss. Well, you may have hearing loss. All right, cool. Want me to take my hearing aid out? Sleep apnea. Go to sleep and start apneaing. Right? I'm kind of making a joke of it, but there's quite a few conditions that you walk in, a doctor can't be like, all right, let's see some symptoms. They come over time, C&P exam, even an ACE review. These are all, snapshots in time. So when you're preparing to tell your story, make sure you tell them what it's like over a month. Maybe that day you go into your C&P exam or you get called for your ACE exam. It's not a bad day. Definitely don't say it's a good day, but you want to give him a picture of what's been going on for the last couple of months. Current disability, current symptoms. That means couple months. Other situations in which the ACE exam process might be appropriate include existing medical evidence is adequate as determined for a clinical examiner to assess the level of impairment per the claim conditions DBQ. A medical opinion is needed to determine whether the disability was incurred or aggravated in service. So incurred, did it happen in service, or aggravated? Did you go in and have a pre-existing condition like flat feet or something, and then your service aggravated that condition, and now you're filing a claim for it? So they may need clarity on those two things. A medical opinion is needed to determine the relationship between a claimed disability and a service-connected disability. Relationship between the claimed disability and something that's service-connected. Where have I heard that before? Oh yeah, secondary VA claims. Good example. For any evaluations completed using the VA ACE process, the doctor has to check off certain things. They're going to review the existing records provided by the VA and what's available in the VBMS, the Veterans Benefits Management System. Whatever evidence is in there, they're definitely going into your VA claims file. Get it so you know what's in there, or at least have some kind of idea or Did you know there's a VA claims file? Like, this is where they go. The VA claims file is money. If you have things working in your favor, positive medical evidence, or against you, negative medical evidence, you want to know that. Get your VA claims file, FOIA request it, and there's a playlist that's called VA Letters on the channel, and you can go look exactly how to do it there. VA claims come down to medical evidence. If you're missing medical evidence because your doctor won't write it up for you, nexus, diagnosis, symptoms, email my med team. There's a link in the description. They can help you out with your missing medical evidence. 3 things you must know to prepare for your VA ACE exam. The first thing you need to know is the VA ACE exam is actually a C&P exam. So know what it is. This exam is not a make you better exam. It is a exam that's only used to evaluate your disability and come up with a dollar amount is what it amounts to, because VA claims are all about money, 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 and I hope you're filing secondary VA claims. The second thing you can do to prepare for your ACE exam is to read your DBQ. You went and, got a private doctor to fill out a DBQ for you. Look at the check boxes, see what the different things are. You're going to, potentially be asked questions on this. And this is a disability you're going to have for the rest of your life. You always need to be prepared to talk about your symptoms. You need regular treatment, and you need to be able to talk about your symptoms. And you need to speak when you're talking about the Veterans Benefits Administration very specifically. Yes, it still hurts. I wake up this many times a night. The pain's an 8 all day long, whatever the condition is. You need to be consistent with your story. So you're going to be notified by one of the contractors. So it's LHI/Optum, QTC, and VES. They're going to notify you and tell you, hey, it's a records only exam. So that's the official notification that, one of the 3 contractors are working on it. That's it for this one. Study your DBQ and you'll be in good shape. You'll know what to say, what they're looking for, what's written on your DBQ. And then, the part we don't know is what they're going to write on their DBQ, the internal use DBQ. Number 3 is the ACE examiner might call you. Be prepared to answer that call. Study your DBQ, have it. Like, cool, I got a C&P exam, it's records only. Like, carry that DBQ along with you. The guy calls you up. Yep, perfect, just a second. Got it right here. What's your questions? Got all the answers for you. So I hope that helped clear up when you might get a VA ACE exam, how to prepare for a VA ACE exam. And as far as the original question, is it good or bad? We'll find out when you get your decision letter. Check out my boot camp at combatcraig.com. And if you need medical evidence, email my med team. There's a link in the description, and I'll see you in the next video.